I'm WWE superstar Titus O'Neil, and today I'm coming to you as a neighbor. You owe it to yourself and those you love to get tested now. Get the care you need and protect your family. Hillsborough County is offering free coronavirus testing and no health insurance is needed. It costs you nothing to get tested. Visit hcflgov.net/stay safe for more information and have a reservation made today. Share this with a neighbor, and let's come together as a community and keep fighting to get through this. Together, we will come back stronger. God bless.
Hillsborough County leaders, along with state and local health and safety partners, are urging residents to be vigilant and stay safe as the county continues to reopen. Aligning with Governor Ron DeSantis' safe, smart, step-by-step plan, establishments like restaurants, bars, gyms, sports venues, movie theaters, amusement parks, and tattoo parlors may resume operations with some restrictions. To help protect yourself, your family, and others from getting or spreading the COVID-19 coronavirus, you should avoid crowds larger than 50 people and continue practicing social distancing. If you're around others, keep 6 feet between you when possible and avoid hugs and handshakes. Why? Health experts say the virus is thought to spread mainly from person to person. When someone coughs or sneezes, they spray small liquid droplets from their nose or mouth, which may contain the virus. Residents are urged to wear cloth face coverings in public places. You could spread COVID-19 to others even if you don't feel sick. The face cover is meant to protect other people in case you're infected. Medical-grade masks are not needed for the general public and should be reserved for healthcare professionals. Continue to wash your hands often for at least 20 seconds, clean frequently touched surfaces daily, and try to avoid touching your eyes, nose, and mouth. Stay home and avoid public places if you're feeling sick. COVID-19 tests are available to any Hillsborough County resident, even if you aren't experiencing symptoms. They are free, no insurance is required, but you must call and schedule an appointment. Visit hcflgov.net/stay safe for more on reopening information along with COVID-19 health and safety tips.
Hi, I'm Hillsborough County Commissioner Les Miller. We're going through an unprecedented crisis as we navigate the COVID-19 pandemic. I understand your challenges, and I'm sympathize with the difficulties many of you are facing during this time. Hurricane season started on June 1st. It is important that you plan, prepare, and stay safe. This year, experts are predicting 40% more storm activity than a typical hurricane season. When a storm is identified, it's important to stay tuned to your radio or television and listen to local authorities. Stock your home and vehicle with emergency supplies and make plans in advance to protect people with special needs and pets. If evacuation orders are called, heed the warnings and follow special instructions related to sheltering during COVID-19 pandemic. I encourage you to visit hcflgov.net/stay safe for information on disaster planning, evacuation zones, shelters, and more. Make sure you and your family plan, prepare, and stay safe.
This is a battle we've never faced in my lifetime. I want to tell you about 416 of the most amazing people. Every day I get to see their skill, professionalism, and dedication. Their commitment to protect and improve the health of everyone in Hillsborough County. The last 2 months, they've been on the front line of a battle with a very dangerous enemy, COVID-19. And they've risen to the challenge in the most amazing, heroic way. Everyone has contributed, sacrificing their personal life, which they put on hold. They're making a difference for everyone they help, and every day I get stopped and told just how amazing they are. I'm proud and blessed to work with them, my second family.
Hillsborough County has teamed up with the Department of Health and other public health and safety agencies to address any impacts the virus may have on our local community. To help prevent the spread of the coronavirus, here are a few tips you should know. Practice proper hand washing by using soap and water and wash for at least 20 seconds. Use alcohol-based hand sanitizer if you cannot wash. Avoid touching your eyes, nose, and mouth. Cough and sneeze into a tissue and throw it away. Clean, high-touch surfaces frequently. Some examples include doorknobs, credit and debit cards, cell phones, keyboard and mouse devices, and toilet handles. Stay home if you're feeling ill. If you have any flu-like symptoms, avoid contact with the public. Avoid sharing personal items in spaces with those close to you. Seek medical care early if you're feeling sick. Symptoms of the coronavirus can include fever, coughing, and shortness of breath. Seek medical care if you develop these symptoms or if you've been traveling or have been in close contact with a person who has traveled from an area with an ongoing spread of COVID-19. We encourage you to visit hcflgov.net/staysafe for up-to-date information and tips.
This is Dave. Dave doesn't know his home's flood zone and was not able to heed flood warnings. Dave and his home are soaked. This is Noah. Noah is an informed citizen. He was warned in advance about potential flooding in his area. Noah took precautions. Noah is dry.
And I saved the animals too.
Good job, Noah. When it comes to flood warnings, be like Noah, not like Dave. For more information, visit hcflgov.net. Be safe, be informed, know your flood zone.
Hello, I'm WWE superstar Titus O'Neil, and today I'm coming to you as a neighbor. You owe it to yourself and those you love to get tested now. Get the care you need and protect your family. Hillsborough County is offering free coronavirus testing and no health insurance is needed. It costs you nothing to get tested. Visit hcflgov.net/staysafe for more information and have a reservation made today. Share this with a neighbor, and let's come together as a community and keep fighting to get through this. Together, we will come back stronger. God bless.
Hillsborough County leaders, along with state and local health and safety partners, are urging residents to be vigilant and stay safe as the county continues to reopen. Aligning with Governor Ron DeSantis' safe, smart, step-by-step plan, establishments like restaurants, bars, gyms, sports venues, movie theaters, amusement parks, and tattoo parlors may resume operations with some restrictions. To help protect yourself, your family, and others from getting or spreading the COVID-19 coronavirus, you should avoid crowds larger than 50 people and continue practicing social distancing. If you're around others, keep 6 feet between you when possible and avoid hugs and handshakes. Why? Health experts say the virus is thought to spread mainly from person to person. When someone coughs or sneezes, they spray small liquid droplets from their nose or mouth, which may contain the virus. Residents are urged to wear cloth face coverings in public places. You could spread COVID-19 to others even if you don't feel sick. The face cover is meant to protect other people in case you're infected. Medical-grade masks are not needed for the general public and should be reserved for healthcare professionals. Continue to wash your hands often for at least 20 seconds, clean frequently touched surfaces daily, and try to avoid touching your eyes, nose, and mouth. Stay home and avoid public places if you're feeling sick. COVID-19 tests are available to any Hillsborough County resident, even if you aren't experiencing symptoms. They are free, no insurance is required, but you must call and schedule an appointment. Visit hcflgov.net/stay safe for more on reopening information along with COVID-19 health and safety tips.
Hi, I'm Hillsborough County Commissioner Les Miller. We're going through an unprecedented crisis as we navigate the COVID-19 pandemic. I understand your challenges, and I'm sympathize with the difficulties many of you are facing during this time. Hurricane season started on June 1st. It is important that you plan, prepare, and stay safe. This year, experts are predicting 40% more storm activity than a typical hurricane season. When a storm is identified, it's important to stay tuned to your radio or television and listen to local authorities. Stock your home and vehicle with emergency supplies and make plans in advance to protect people with special needs and pets. If evacuation orders are called, heed the warnings and follow special instructions related to sheltering during the COVID-19 pandemic. I encourage you to visit hcflgov.net/stay safe for information on disaster planning, evacuation zones, shelters, and more. Make sure you and your family plan, prepare, and stay safe.
This is a battle we've never faced in my lifetime. I want to tell you about 416 of the most amazing people. Every day I get to see their skill, professionalism, and dedication. Their commitment to protect and improve the health of everyone in Hillsborough County. The last 2 months, they've been on the front line of a battle with a very dangerous enemy, COVID-19. And they've risen to the challenge in the most amazing, heroic way. Everyone has contributed, sacrificing their personal life, which they put on hold. They're making a difference for everyone they help, and every day I get stopped and told just how amazing they are. I'm proud and blessed to work with them, my second family.
Hillsborough County has teamed up with the Department of Health and other public health and safety agencies to address any impacts the virus may have on our local community. To help prevent the spread of the coronavirus, here are a few tips you should know. Practice proper hand washing by using soap and water and wash for at least 20 seconds. Use alcohol-based hand sanitizer if you cannot wash. Avoid touching your eyes, nose, and mouth. Cough and sneeze into a tissue and throw it away. Clean, high-touch surfaces frequently. Some examples include doorknobs, credit and debit cards, cell phones, keyboard and mouse devices, and toilet handles. Stay home if you're feeling ill. If you have any
Welcome to the Hillsborough County Emergency Policy Group meeting. Will the clerk please call the roll?
Good afternoon, Miller.
Here.
Overman.
Here.
Merman.
Here.
Chronister.
Lozinski for Chronister.
Castor.
Here.
Ross.
Here.
Lott.
Kilton for Lot.
And Snively.
Here.
And Ms. Wise.
Here.
Thank you. You have a quorum.
Thank you. Now moving to public comment. We've allotted 20 minutes for public comment, a total of 20 minutes. Each speaker will have two minutes to speak. We have right now 8 speakers that are signed up. The first speaker is Jason Kimball.
Okay, guys, so I think the EPG should be totally ashamed of itself for continuing the unconstitutional executive order that was issued last Monday, the Monday before last. So I mentioned in my last call a therapeutic, thymosin alpha-1. By now, you all have had the opportunity to question your experts and to learn they don't prescribe it. It differs from other compounds in that it was developed in America and is FDA approved. The trade name is Zadaxin. It's by Cyclone Pharmaceuticals. It's not research only. It has been clinically approved. So what excuse do the EPG experts have for not utilizing it? As I said last week in the latest study, 63% more people with severe COVID-19 live in the thymosin alpha-1 group with subcutaneous injections. So the EPG really needs to think about the qualifications of the experts that are pushing for mandatory face coverings. We've heard them speak here. We know their supporting evidence is incredibly weak, and we know their treatment protocols are garbage. We've seen the outcomes. We've seen them parade their dead patients in front of this emergency policy group. So is it responsible to pass and certify these unconstitutional executive orders on the basis of these experts? No, it's not. They have no rational basis to recommend mandatory face coverings. And because the EPG has let our community down and has exercised terrible judgment, I was forced to start a crowdfunding campaign to file a lawsuit to oppose the outrageous, economically suppressive, socially suppressive executive order that was issued a week from last Monday. So we met our fundraising goal in 24 hours. That's how strongly Hillsborough County residents disagree with how the EPG has conducted itself. So guys, it's unconstitutional. Your experts are terrible. I mean, you could say, just looking at their treatment protocols, they're unqualified. And from now, moving forward, I'd like the experts to disclose their treatment protocols whenever they address the EPG. Thank you.
Thank you, sir. Your time is up. Thank you. Chris Ann Hall.
I would like to ask Attorney Beck to explain to this group about the legal principle of arbitrary and capricious. I ask this because I care about Hillsborough County, and as a taxpayer, I don't want to have to pay for the errors that could be prevented. Ms. Snively knocked it out of the park on Monday when she asked Vice Mayor Ross if he had any scientific or legal basis for choosing the age of 8 for masking children. When he basically answered, I don't have any, I just know my own kid, his answer was the epitome of arbitrary and capricious, and then everyone in the group voted in favor of this. This is a constitutional law no-brainer that will be overturned, costing taxpayers time and money, and it could be avoided with just a little understanding of the proper creation of laws. Another example is the fact that this group is mandating by criminal penalty the wearing of masks when the science and facts are simply not settled on the issue. The New England Journal of Medicine recently published a respected peer-review article on the efficacy of masks, and they said, and I quote, "We know that wearing masks outside the healthcare facilities offers little, if any, protection from infection. I quote, even in critical environments, the extent of marginal benefit of universal masking over and above these foundational measures are debatable." They also said, given the lack of medical evidence, masks are only, quote, symbolic or mere talismans. They only serve to, quote, relieve a perceived sense of safety, or they are illogically based on fears. The very fact that medical science disagrees about the efficacy of masks to prevent the spread of COVID makes the mandate with criminal penalties arbitrary and capricious. this group must vote to either remove the order completely or amend it to make masks voluntary. A mandate under these conditions will not withstand a challenge of law, costing taxpayers unnecessary dollars and crashing our economy, destroying businesses that will be unable to restore their position.
Thank you, ma'am. Your time is up.
Society.
Thank you. Tabitha Olson.
Hello. Hi. I would like to, the thing that I want to address is I want to address all 6 of the people, Kimberly, Sandra, Chad, Melissa, Rick, and Andy, and Jane Castor. I am actually calling for a dismissal of all 6 of them. I think that they should recluse themselves. I think the state of Florida should charge them with treason. And I'll read what the state of Florida Senate says. Treason against the state shall consist in only in levying war against the same or adhering to the enemies thereof or giving them aid and comfort. These people who mandated this face mask wearing should be immediately dismissed from their position and charged with treason immediately. They do not care about the people of Hillsborough County. They have no decency at all. As of right now, there have been 145 deaths in Hillsborough County for a county with 1.5 million people. There are 325 total hospitals in the state of Florida, and not one of them is fully masked. I will make it my life mission to single-handedly make sure that all 6 of these people do not ever work in government again. They have no decency at all. And how dare you mandate anybody to wear any type of mask over their face? And I promise to you that I will make it my life mission to make sure that you are out of government. You do not care about the people, and you should be charged with treason, all 6 of you. And if you have proven, if you scare people badly enough, you can get them to do anything. You do
Thank you, ma'am. The time is up. Thank you.
Over their face.
Thank you.
Thank you.
Noah Olson.
Hello, my name is Noah Olson, and I'm 13 years old. I feel like when we wear these masks, they're not covering up anything, and by locking down parks in cities, we're not stopping the virus from spreading at all. As a student, I do not like to see my teachers and peers in masks because if I can't understand them, I cannot follow in what they're doing, do what they're doing. It's scaring me. It scares me to see that people are in masks. I don't like to see a lot of people in masks because the mask isn't stopping anything at all. And that's all I have to say.
Samantha Olson.
Hello, my name is Samantha Olson, and I am 9 years old. I believe that we shouldn't wear masks because they're covering up our identity and facial expressions. Because by bad people and robbers, if someone's trying to rob a bank and they have a mask on like everybody else, we won't know if they're bad or not. So it's covering up our identity, and it's very unsafe. And also, it's also kind of scary to see people in masks because I don't know if they're bad or they're evil or what's going on and stuff. In places like parks and basketball hoops, they're closed. But the places like Universal, they're open, but parks aren't. It doesn't make any sense because we can't play basketball at a basketball court, but we can go on a ride if we pay the money at Universal. It doesn't really make any sense, and it's not good. And it covers up our facial expressions because while I was riding my bike, I said hello to I smiled at a lady, and she had a mask on, so I didn't know if she smiled back. So they're covering up our facial expressions. And also, for students that are deaf at school, a lot of them read lips. And if the teachers and stuff have masks on and students have masks on, it's very hard for them to learn, and it's not fair.
Thank you, Samantha.
Please don't make us wear masks.
Thank you. Deanna Gilbert.
Yes, thank you for your time. I just want to say that this whole mandated mask thing is a sham. If you look back at different articles, which I pulled up one from Business Insider, where the WHO and the CDC can't even come together on if it should be mandatory or not. The WHO is saying that it doesn't do anything for a healthy person, in which I am a very healthy person and I won't be wearing a mask, but it does protect a healthy person from a person who is sick. If you're sick, I'm all for you wearing a mask, but you cannot mandate a healthy person to wear a mask. This is becoming more like a dictatorship, the six of you, than it is to help about helping the community. You guys need to realize we're not a communist we're not a communist state, and you guys are not communists. I don't think so. But if you want to act like communists, we can overthrow you guys. This is ridiculous. You can do voluntary masks, but you cannot mandate and then penalize people for not wearing a mask. That's ridiculous. Would you want somebody to do that to you? No, because then it would be an infringement on your rights. So don't infringe on ours. Thank you for your time.
Jason Williams.
Thank you, Mr. Chairman, and thank you, EPG members. My name is Jason Williams, and I live and work in Hillsborough County. I've been listening to every EPG meeting since the beginning of this pandemic, to my knowledge. Thank you for the opportunity to speak today. I'm asking you to either revoke the face mask order or amend the order for voluntary compliance. Last EPG meeting was the only meeting that I'm aware of that spoke of the recovery rate stats. In my opinion, this is just as important as the infection rates. This board is making incredibly important decisions that affect our everyday lives, our livelihood, our children. Every aspect of our lives are being negatively impacted. Again, I've been listening to every meeting, and although I appreciate government experts, the doctors and professors, rarely have I heard of the economic impact of the decisions coming from this board. I have not heard or seen economic experts, people that know the economics of our county and how this body's decisions are affecting its citizens, its voting citizens. Additionally, there's been no diversity of opinion from the medical professionals. It would be crazy to be diagnosed with a serious illness without a second opinion. I echo Mayor Lott's request when he asked for other opinions to be presented on these meeting calls. One doctor a few weeks ago said there would be dead bodies in our county streets. That's not happening, nor will it ever happen. Dr. Holt said last meeting that there's at least a 95% recovery rate. That statistic does not reflect the extreme actions of this board. I'm asking this body to revoke or amend the mask order. Thank you, Mr. Chairman and EPG members, for your time and careful consideration.
Shannon Gilbert.
Yes, I just wanted to state my thoughts here that, in all honesty, the EPG should be ashamed of the parading of patients and their dead bodies to incite fear. And well done if that was the plan here. But in addition to this, I would like to say that the placement of COVID patients in those that we consider at risk being placed among them, we're doing a great job of following suit of New Jersey and following of New York and following of Chicago and Michigan. And so we're doing a great job pulling out of that playbook. And then on top of that, the lies from the doctors talking about the hospitals being overran and being understaffed when we personally know nurses who have been furloughed. So if we're going to pull some so-called experts and they're going to tell lies, they should do at least a better job of trying to conceal their lies. In addition to this, there is no method of consistency. And if the flu had killed so many more people and then we're looking at COVID, then why don't we have masks required during the flu season? And in addition to that, if we think about it, Sunday, Monday, Tuesday, and Wednesday had the lowest death rates across the nation since this pandemic started. So if looking at this, if there was an invasive species that was spawning at an alarming rate, and however the birth or the hatch rate was at 0.036%, would we then create a task force to deal with it? No, because we would actually be creating a long-term solution for a short-term problem.
And so we've seen, as Jason just noted here, quite a few experts, but none dealing with the economy or the repercussions or the destruction of the economy here in Hillsborough County. And it's irreparable damage that's being done, and it seems that no one really cares what's going on. They're just pushing their agenda, and these calls are just a form of formality. But in fact, it looks like the decisions have already been made before even coming onto this call. So there is a consistent itching towards the encroachment on the rights of the
Thank you, sir. Your time is up. Thank you. Thank you very much. Did Alexia Morales or Greg Reynolds come on?
No, sir. That completes public comment.
Okay, thank you very much. Completes public comment. Emergency management update, Mr. Dudley.
Good afternoon.
Good afternoon, sir.
All right. We continue to support in-home testing operations at remote collection sites: Raymond James, Lee Davis, South Shore, Plant City, Brandon, Sun City Center, and Waimamo. Testing conducted last week, close of business 6,168. Total tests since beginning of operation is well over 43,000. Testing conducted this week as a close of business this Wednesday, 5,465. As you can see, Raymond James is up to 2,005. We completed a smooth transition over to the state. The state medical teams are collecting those tests with support of county and the city of Tampa personnel. As of close of business on Tuesday, we had 4,475 appointments scheduled for last week. This week, we have 8,138 appointments scheduled for this week. Again, noting Raymond James is up to well over 4,000 appointments scheduled for this week. For just an update on the schedule for Raymond James and the Brandon location, they will be closed July 4th, and they will resume collections the following Monday, 6th July. We continue to support logistics operations. The logistics team doing an outstanding job. They conducted a Plus Up initiative where we pushed out PPE to county departments, transportation partners, municipalities, law enforcement, school board, ALFs, and nursing homes. Thank you to those teams for getting those critical supplies out to all our departments and partners. We have state collection kits, so current collection kits on hand, over 14,000 on hand to support Raymond James operations as well as the continued county sites as well. We continue pushing out cloth mask. We'll be wrapping up as of 12 noon today at the E.G. Simmons location, Lake Park, Lithia, and Upper Tampa Bay. We will close out those operations there, and we will continue to explore additional locations and opportunities to distribute free face mask covering in the future. And donations, no change in donations. Effective 30 June, we would like any medical supply donations, please schedule in advance for a drop-off at 813-221-6561. We have 1 guest in quarantine site and 25 guests in our isolation sites. That concludes my update. Any questions?
Thank you, Mr. Dudley. I see no questions at this time. Thank you again.
Thank you.
Public health update, Dr. Holt.
Yes, this is Dr. Holt, Florida Department of Health, Hillsborough County. I'd ask Kevin Wagner to put up his PowerPoint, please.
It's up, sir.
I've been working with various Hillsborough County staff from the IT, communications, working to create a Hillsborough County COVID dashboard that will display our local information and help us provide a current assessment of where we are, how we're doing as we move forward. This has not been as easy as I thought. There are two critical steps. My part is to determine and select the benchmarks to follow and that will assess the impact of COVID is on our community. We're going to format it in a stoplight rendition, red, yellow, green. We're going to start with our standard 8 benchmarks that we have been using since the beginning. It turns out the second and hardest and also the most critical is to automate the data download process that is currently done manually and daily by Mr. Wagner. I really want a special recognition to Kevin. I've been blessed to have had him loan to me of his services over the past 4 months. I knew his expertise from the Hillsborough County Healthcare Advisory Board and his talent for data, but he's really been invaluable in helping me select some of the benchmarks and how to display them so this data becomes informational in an understandable way. The Hillsborough County IT staff are also amazing in how they have created a process to automatically download the data we need. And communications are going to ensure that the layout is accessible, short, understandable, and relatable to the public. I'm both confident and excited for this. This presentation will give us a start or a glimpse of what we were hopefully moving forward. The same information that we have presented, but more in the form of a dashboard. We'll additionally, as requested, we're going to provide an update on our racial and ethnicity demographics that we did about a month ago. Previously, that was presented, the data was presented in 2-week intervals looking for a change. But given that we've had so many cases over the past several weeks, we can now use the cumulative data available and feel comfortable that it is an accurate picture of what is going on. As you will note, the limitations are going to be a high number of unknown in both the race and the ethnicity. The reason for this, the race information is not available on the lab results. We can only get that through interviewing or if we have access to medical records. So the reason for this increase significantly from a month ago is somewhat the delay of actual processing the data from our interviews into the system. So over time, that will take care of itself. But of course, the other reason I've mentioned is that we're having difficulty connecting, and those we are reaching have been reluctant to give us the information we need. I apologize for the delay in sending out the presentation today. This was a result of an effort to both establish the dashboard and also to provide information that had been requested by Ms. Snively actually on the age breakdown of both hospitalization and deaths. While we were working to develop the dashboard, the IT gate made it possible that we could have access to something that I did not know was available, and we can now use this rather than depending on the hospitals. Again, at first glance, I think we'll see no surprises. Our older population represent the highest percentage of our hospital admissions and an extreme disproportional risk when compared to what they represent as the proportion or the percentage of the population. But interestingly, there is notable an increase in the 25 to 44 age group over the last month. Again, we'll do deaths by age. We've had 145 at this time. 91 are associated with long-term care. But this time we're going to show it by age. And again, absolutely no surprise, the risk of dying is significantly increased, and it increases steadily with age. So let me begin with slide 2, Kevin. So as of this morning, the number actually has been updated to 12,377 cases as we reported 894 since this presentation was created. This is a 66% increase over our last 7 days. This is reflected, and when you look at it over the 14-day average, continued increase dramatically of almost 240%. On a positive note, our testing, we are 30% above our target of 2,250 a day. But also concerning on the other side is that of those tests we're doing, almost 20% are coming back positive. The meaning of all this information is that our community-based transmission continues to be widespread at a very high level of activity. Next slide, please.
Go ahead.
Examining our hospitalizations, this rolling 7-day average has increased to 294, a 42% increase from the past 7 days. Notably, as of the information I had of this morning, as of 7/1, we now have 335 people in the hospital with COVID. The 7-day rolling average for hospital beds has remained stable. So we're not the beds. There's not a bed shortage in the general beds, but we are starting to see a squeeze in our ICU beds availability. The rolling day average for admissions have shown a significant increase, up 44% from the previous 7 days. And somewhat concerning this last week, we have seen sort of a second surge of our transfers from long-term care, but this time they're not proactively, they're not asymptomatic, they are symptomatic. So hospitalizations typically follow infections about 2 weeks, so I think we're beginning to see some changes related to that. Finally, the rolling 7-day rate per day is 2.7. That's an 11% increase. Again, deaths usually are lagging, and they typically follow infections of about 4 weeks out. With that concludes my presentation, and I would like to ask Mr. Wagner to proceed through the entire presentation, and then we will be available for questions.
Great. Thank you, Dr. Holt. Members of the EPG, Kevin Wagner, Business Analyst, Hillsborough County Healthcare Services Department. As indicated, as of yesterday, there was 11,400 aggregate cases in Hillsborough County. That number is now above 12,370. To date, when we look at the testing rate completed, it's almost nearly 9% of the population's been tested. Again, I can't account for individuals receiving the test multiple times, but on an aggregate, we're almost nearly 9% tested. And again, women generally so far in Hillsborough County have a higher positivity rate on the aggregate, 53% to men, 47%. As requested on the ethnicity and racial breakdown, what we did show this a month ago, so I'll speak to the top slide, which is the race, the top table of the slide. On the white, the census projection in Hillsborough County is 69, nearly 70%. To date, on the positive cases, it's only 29%. I bring up the white Caucasian first. As Dr. Holt indicated, we have a large unknown population. The unknowns have generally occurred from June 15th to now. The surge, as Dr. Holt indicated, the contact tracing, trying to follow that information. Prior to June 15th, we had a fairly consistent rate with small unknowns, so we were pretty aligned, but since the surge has happened, there's a large unknown population. We cannot assume that that unknown population falls into the white Caucasian population. That just would not be statistically relevant or a good decision making. But what we do know is 29% right now is white. What we do know on the African American, it's 14% compared to 16% of the total population. And the other, which would be Asian, Native American, and other race groups, are nearly identical, nearly 13% each. So again, we do have that unknown population of 44% currently. When we go down on the slide to the ethnicity, again, it's the same conversation with the unknown, but what we did bring this in for the Hispanic to see what we know. On the Hispanic, it's 29% of the census population in Hillsborough County, and known, for total results of COVID, nearly 20%. Again, non-Hispanic, as we see, 70% to 30%. We don't want to assume that unknown goes into his non-Hispanic. We just cannot assume that until we get more accurate information at this time. But again, on the African American and the other minority cases that we know, seems to be aligned with the total population. Positive cases on a rolling 14-day per day, as Dr. Holt indicated, the 14-day average is about 512. The 7-day average is 650. So again, the yellow bars show us the increase again since June, really June 15th, June 16th, that's been the increase. If we added in today's bar, that would be a nearly 900 more. So again, we see that trend repeatedly going up. With regard to testing, as Dr. Holt indicated, that is a good thing. With the solid brown line, the rolling average of the 7-day average is 3,600, so that is good. So currently, we're meeting that mitigation threshold of 2250 as a baseline to meet for testing. We'll go back to and discuss with Dr. Holt, should there be another benchmark higher than 2250 in our evaluation. But right now, the rolling test for the 7-day average has been quite good for Hillsborough County in the sense of results being reported. When we look at positivity rates, again, it's the same conversation, but again, the 7 and 14-day positivity rate is nearly 20% on each metric. So again, everything has flattened out to where the last 14 and 7 days, you're basically at a 20% positivity rate on any given day, as indicated by the green bars. Again, that's where we are right now in the county with the test results coming back. Hospital admissions. Again, this is the daily hospital admissions self-reported by the hospitals for individuals with COVID. This doesn't tell discharges. There were 63 admitted. This does not tell how many were discharged. This just tells the number admitted. We can see the 7-day average is nearly 60, the dotted line, but we see a consistent 60 since June 23rd has been nearly every day at or above 60, with a high of 87 one day in June 26. So again, the hospital admissions are trending upward as well. Looking at the total hospitalized, this is for the ICU and non-ICU, total occupied in the beds. On June 30th, on the far right-hand side, there were 348 individuals in the hospital system in ICU and non-ICU beds who were hospitalized with COVID. We see the gray, which is the non-ICU COVID at 288. So that trend line's been consistently going up. Historically, that has been since June 23rd as well. And then the orange line is the individuals on ICU or in ICU. We're at 60. That's been trending generally flat. But again, on June 30th was a single uptake. We will continue to monitor that. But again, that is your breakdown of the 348 individuals hospitalized currently. The ED visits with COVID-like illness. Unfortunately, this wasn't updated on the FDOH website. This is still the same numbers that you saw a few days ago, 798 on June 21st. Hopefully there will be another update by the end of the week or next Monday. And on June 14th was 620. So again, that was a 30% increase at presenting at the ED, the emergency department on the hospital system. hospitalizations as requested by Ms. Snively, looking by the age group. This chart is not as clean as I would like because we were working on this morning, but I will speak to the chart right now. So on the total aggregate hospitalizations in Hillsborough County, the total of these numbers is 630, 640. So on the far right-hand side, 65 plus in age so far have been known hospitalized as self-reported through the FDOH, 318. So they make up 50% of the hospitalizations in Hillsborough County, but they only make up, this age group, 14% of the population in the gray bar. So there is that disparity of variability where individuals in 65 plus are being hospitalized at a higher rate than the census population. The same is generally the same for the 45 to 64 of age, the 193 in the middle. So again, that's trending about the same. Then we go down to the 25 to 44. So where it's inverse, 28% of the population, 15% of the hospitalizations. The next slide, we'll talk a little bit more about the timing. And then we look to 0 to 24, quite different in the inverse relationship. But now we talk about time. We talked about aggregate in the previous slide. Now let's talk about time. On the dotted lines, the blue is 0 to 24. So in March, 1.6%. So 0 to 24 made up 1.6% of the hospitalizations in March. Roll to April, roll to May, roll to June. Now they make up 6%. So they are slightly trending upward. The 15 to 24, the orange line is the largest one. They were 15% in March, 14, 10. And in June, they had a significant increase. They made up 23% of the hospitalizations in March. So again, as we see the surge occurring, we're seeing the increase in that age group, 25 to 44, being hospitalized. The 45 to 64, again, that's trending somewhat flat the last 3 months, near 30%. And then the 65 plus, again, that trended very high, around 54% in April, nearly 60% in May, and coming down in June. So as we've talked about in multiple points of presentations, the 25 to 44 are the ones getting the highest caseload or positivity rates recently. And from the May to June, they've had a highest increase in the hospitalizations. Again, while aggregate, they're underneath their census population on the previous slide, but from a trending time standpoint, from May to June, they had the largest jump. Again, for Ms. Snively regarding the deaths that are known have reported, we received this information from the county medical examiner's office through a positive relationship we have with them. Again, 98% of the cases of deaths in Hillsborough County have been individuals greater than 50 years old. There's only been a couple, 2 or 3, under that age range. So what we're seeing from a death standpoint, with COVID being the cause or contributing comorbidity, 65 to 74, 75 plus, 85 plus. So in those examples, the orange line, 28%, 26%, 31% are significantly greater than their population makeup. So again, the older population who is getting this has died on a percentage higher than their census population. So again, and that's true at the 55 to 64, nearly 55 to 64, and it's inverse under 55. So again, the older population who are getting this are dying or passed away at a higher clip compared to their census population in the age groups. But again, a vast majority of the deaths, 98%, are 50 years and plus. And I'll stop there. Thank you.
Thank you, Mr. Wagner. We have a question. Commissioner Overman, you recognize?
Thank you, Chair. I truly appreciate it. Most of this has to do with the data. I recently received information from Dr. Curran, which has been distributed out to the EPG members Dr. Cran, you know, is the USF founding faculty pediatrician and chair with the Hillsborough County Health Advisory Board. And I share that for the listening public. Dr. Cran is sounding an early warning that infection rates are growing between the ages of between 15 and 34 in his email. And he's concerned about transmission to younger children by their asymptomatic young adult family members, which is an exponentially growing cohort. We can see from the numbers we heard from Dr. Wagner, that's the greatest number of people that are actually being infected at the moment. But what we don't have is certainty on how COVID-19 is being transmitted to younger children, even though they're not dying, which is really great, and they don't seem to be hospitalized at a great rate. They do like hanging out with their grandparents, and they do ultimately at some point in time are going to go to school and interface with other teachers and students. So I'm asking about contact tracing again when it comes to how we're tracing our children and how they are being tracked, and if there's a correlation between those that have been hospitalized and testing positive. Because I think that's really important as we prepare for the school year. Can someone answer that question, please? I've asked it several times. I'd really love to get an answer.
This is Dr. Holt. I'll do my best. The contact tracing of children, in our county, the children that we have identified as positive cases are almost, if not exclusively, associated with the family's transmission within the family. And they were not the first case. They were secondary cases. The question sometimes has been asked is where did the first case, who got infected first in that family? But we can't easily answer that. But for our children, they're being infected by their family members, which isn't surprising because whether it's the lockdown or in general, they spend most of their time with their family members. And hospitalizations of those children hasn't changed the fact that the source of their infections, at least the ones that we are, and then we do pretty good at contacting children in their cases because parents are quite cooperative. I'll stop there.
Well, and this is where I'm going with this. Based on the slide number 13, 31% of our census population were hospitalized, or of the count of our percentage of population, were hospitalized with COVID in that age group. And 29% in the 25 to 44 age range. Those are the ages that children in their household have parents. And those are also a lot of the age ranges of our teachers. So I think it's critically important that we recognize that children are going to be exposed. And unless they are not spending any time with their grandparents, those individuals they will come in contact with have a likelihood of being exposed, whereas they, as you mentioned, they've been staying home. So I'd like to find out what we're doing in order to improve our contact tracing, and that's why it's so important. We're going to be finding ourselves in a situation where teachers are going to be interfacing with children, and this is especially concerning when the American Academics of Pediatrics is recommending our schools open, which is understandable, but there does not appear to be a strategy to address concerns of teachers and other professionals that work in our schools. Many of our teachers, cafeteria workers, and environmental staff and administrative staff are in the age range between 24 and 34 and are at high risk in that high risk age range group. So I'm really curious, Dr. Holt, is there a protocol for regular testing of staff to ensure that, if they're getting infected by asymptomatic children, if we don't know if those children are asymptomatic, or if we don't haven't actually traced those children that have had a household member that's positive and ill. Because otherwise they're unknowingly transmitting the disease to other children and ultimately to other individuals in that age range.
This is Dr. Holt. There's no protocol for the school district or the employer outside of the long-term care facilities to regularly test their staff. And again, as we talk about when school opens, there will be a significantly focus of contact tracing within that environment. And that's not just for the young children, but all the way up to the university level. And we are working with both the school district and the university to be prepared to rapidly and quickly look at cases within both of those settings, because they would be a priority of our contact tracing. And the studies, and we've talked a lot about that. And again, I keep in touch with Dr. Curran and Dr. Emanuel, who are who are my best advisors on pediatrics in schools. Is there's a variety of different literature and studies and almost opinions about the role of children in the transmission of COVID-19. And despite that uncertainty, I think we clearly want to make every effort to ensure that the schools remain very safe and not the source of both transmission in the schools, but much worse, as you're talking about, which is back into the community, particularly into our elderly. So I'll stop there.
Okay, well, thank you very much. I think the issue is that, I've asked about how many people are working on contact tracing, how they're trained, and what percentage of individuals who tested positive have been contacted, and what percentage of those have provided information necessary to identify transmission to others. We are going to have to ramp up to get ready for when many more people are out in public, such as children going to school. So I really would like, and I'm sure Dr. Curran would appreciate having that information, because it does seem as though contact tracing for children has not been either available or a priority. And I'll stop there.
Mayor Castro, you recognize. I'm sorry. You going to say something about the Hope?
No, sir.
Okay. Mayor Castro, you recognize.
Thank you, Chair. I want to make a quick observation, and then I have a question for you, Dr. Holt. First of all, we're all hamstrung because we don't know a lot about this disease. We keep learning more and more from week to week, and we're all trying to make decisions in the best interest of our community based on data. And one of the things that I think we all know is that in order for data to be valuable, it needs to be accurate and timely. And we have such difficulty with the timeliness of the data that we're receiving. When we look at those charts with the positivity, it's not, bless you. It's
snuck up on me.
It's not necessarily what the community may think it portrays, and that is the number of positive cases we have every day. It's the number of cases that have come back, quite often in batches, from the testing facilities. And so, I had a conversation, like, for example, another thing with the timeliness of the information, the ER visits, that information was from almost 2 weeks ago. So, if there's any way that we can get this data in real time, what the hospitals, what their numbers look like. I know with the testing, it's a little more difficult in getting that information back from the various labs. And it's come down to 5 to 7 days. So we can look at that sort of as an accurate portrayal, but still we're making decisions based on information that's almost a week old, and in some cases more so. So I'm landing the plane and getting to my question. Dr. Lockwood indicated that yesterday we should start to see a decline in the positive cases based on the adherence to the mask order, which is very, very, very high in the city of Tampa. So here's my question for Dr. Holt. Since we're going into a weekend, Friday, Saturday, Sunday, what are we going to see on Monday? Are we going to see an incredible increase in the number of positive cases because we're going to have 3 days worth of data? Or is that number going to drop? And if it drops, is it accurate? Or can we put any weight in that, because we don't know when those cases or when those tests were taken, when those kits were actually sent in? And I'll stop there.
Yes, ma'am. I don't know exactly. I don't know what we'll see as far as the exposures and ultimately lead to infections that would occur at any time, but particularly, as you mentioned, the holiday, the July 4th. The experience we saw with Memorial Day is that typically takes a week or so, at least, for people who have spread the infection, whatever day it is, but in this conversation, that weekend, that you would then see a surge, if you will, or a consequence, of whatever's happened. So our data, not just when it was tested or collected and the results come back, always represent an infection when the infection was acquired about 7 days before either illness or getting tested. So it's always inherently delayed. So bottom line is...
My question isn't in relation to the holiday weekend. My question is, will all of the test results from, if they continue processing those kits Friday, Saturday, and Sunday, are we going to see a huge data dump on Monday that shows an inflated positivity rate? Or do you have any idea about that?
Yeah, I think I don't have any certain idea. They're going to continue to dump, if you provide resource or results throughout the weekend. And I look at the website, Florida Department of Health website, every day, because that does give you at least the daily results. The dumps occur when the labs basically get overwhelmed. And as we are watching the timeliness of how the results come back, that's usually what triggers the data dumps. And so I don't know how to predict what is going to happen, but I would not expect this weekend to be any different than past weekends necessarily. I'll stop there.
Okay. Thank you, Chair. Thank you, Dr. Holt.
Mr. Snively, you recognize.
Thank you, Mr. Chair. So I want to thank Dr. Holt and his team for providing some of the information that I've requested, and it's really kind of in a quest to just make sure that the information that the EPG is getting is maybe a little more balanced and a little clearer, so that we can make some decisions that will be helpful to the public. And so thank you for providing that additional information. I think those are important statistics when you are trying to look at the big picture. And I know that was something I think Mayor Lott wanted to make sure that we're doing is having a more balanced approach and a bigger picture. So I'm hoping that some of that additional information that you've provides that. Before I ask my questions, I did want to address a little bit of Commissioner Overman's comments and concerns maybe that she's been getting from some of her constituents, and a lot of it has to do surrounding schools reopening. And I just want to give everybody a quick update, and especially for the public who are listening as well. The superintendent has not finalized his plan. I know a lot of people are talking about, going back to school and everything being normal. Well, we don't know what's going to happen. We're in July now, but we all know that this situation is very fluid and it changes weekly. The superintendent is doing his best to get feedback from parents to see what they're going to be comfortable doing, whether it's sending their children back to a traditional classroom or the distance learning or the virtual school. He's trying to gather as much information as he can in order to make that decision about what it will look like if and when we reopen schools. And some of that obviously depends on the Department of Education and the governor's orders. I will tell you, though, that the health and the safety of our students and our teachers and our staff is still going to be the number one priority for our school district. And I think that the governor, from what I understand, is going to provide some further guidance on the reopening of schools coming up on Monday. So hopefully I can give you an update as EPG members and the public about a little bit more about the governor's plans. But I did want to say that if we go back, if we go back to schools in a traditional sense, that the district is providing face masks to every student and every teacher and every faculty member in the district. We've got multiple masks coming from different sources that are reusable. So hopefully the superintendent can finalize his plan and get something out to the public. Everybody is concerned. Everybody's concerned about the health and safety of students and teachers and staff. So I want to make sure that we acknowledge that information, because we want to make sure that information is getting out, that the superintendent is taking all of those things into consideration as he's making his decisions with his leadership team. So there's a lot of unique and special needs that we have to take into consideration with masks and students and the instruction of students, especially the younger students and students with special needs. So I just wanted to just kind of address that concern and some of those concerns that Commissioner Overman had. Moving on, I kind of wanted to.
Can I ask you a question?
Yes, sir. Absolutely.
You just said that the school district will be supplying masks to students and staff. Of course, you have those that have special needs. Is that going to be voluntary to wear them, or is it going to be a mandate?
That is what is being determined right now. The superintendent has not made a final decision on any type of mandating of masks, and so he's really leaning on public health officials and education professionals and pediatrician recommendations. So there's a lot of information coming at him. So he has not made any final determination as of yet, but at the end of the day, it will be the superintendent and his staff's decision as to whether those masks will be required or not required to be worn. Okay?
Okay, proceed.
Thank you. Back to Dr. Holt's presentation on slide 2, I just had a couple of questions because I noticed that there's a couple pieces that are not included in your slide, and I was hoping that maybe in addition to what you have, you could slide in. For example, and I don't know if you want to put slide 2 back up, but we talk about the population that's been infected, and you talk about the increase in the population or percentage that's been infected, but we don't talk about the percentage of the overall population in Hillsborough County that's infected, and I think that's important. I understand watching the trends, and that's very important to watch the trends, but it's also important to take a look at the big picture as to what percentage of the actual population in Hillsborough County has been infected. And so I'm hoping that maybe you could slide that information in, as well as the percentage of the population that is the death rate as well, because we have, obviously you share the death rate with us, but what percentage of the population has actually died from this disease or this virus? And so I think those are two important things to gain perspective, is what percentage of the population has been infected and what percent of the population has actually perished from this virus. Is that something that you could also include in this information, sir?
Absolutely. Yes, ma'am.
Awesome. And then on slide 9, we talk about the positivity rate Are we tracking the individuals who go to the testing sites? Are we tracking how many of them are actually symptomatic versus asymptomatic?
I'd have to, that I'm not doing the testing sites. I don't believe so, but I would refer that to Mr. Dudley from.
Mr. Dudley. Okay. Just curious, because I think that sometimes we get a skewed perception of the positivity rate, and it is concerning that it's increasing. But also, we need to be aware that the people who are going to get tested are the symptomatic people that are getting tested. So, of course, the more people who have symptoms who are going to get tested are probably going to be positive. So it's even more important to continue, testing as many people as we possibly can. And we can go back and I can talk to Mr. Dudley offline a little bit about that and maybe bring some information back to the group. But I was curious about that. And I just want to make sure that we take that into consideration.
Ms. Snively, I have to disagree with you on that. I don't think that everyone going to get the test is symptomatic. I don't think that's true.
No. I'm just saying that I'd like to know what percentage of people are symptomatic versus non-symptomatic. Because I think they're asking that question when you roll up to take your test. Do you have symptoms or do you not have symptoms?
Ms. Snively, this is Dr. Holt. I don't know, and again, I would defer to Mr. Dudley on the public sites. But in talking to the ones that are run by the hospital, the Bay Cares, the Tampa Generals, those are symptomatic according to their criteria, as are the ones that we would collect at our sites. That's part of the criteria to be scheduled. But I do not know about the Raymond James and the others, particularly now with the state taking over. I believe they're very open to anybody and everybody, which we actually initiated here several months ago to allow people so they wouldn't have to answer yes, I'm sick or I have a doctor's note. I'll stop there.
Okay, I'll revisit that with you offline and Mr. Dudley. So I'm trying to get through these quickly to respect the group's time. On the emergency room visits, I was also curious if we can get, and maybe I missed this number, but out of the ED visits, how many are actually hospitalized versus how many are released? Is that a number in our presentation somewhere?
It's not in our presentation. That's one of the challenges that I think you're aware of. That as I'm working with the hospitals to try to get information, it hasn't come as much or as frequently, and I understand a little bit of it is their challenge to collect the data or some way, but I haven't had as much response. The data that you see here is when the person comes into the emergency room, they complain of something, and the doctors, when they enter that data into their medical record, we extract it through a surveillance system called Essence. And so we get this report, but the state only gives it to us weekly. I am working to see if we have access to our own local data that would give me access to it on a daily basis rather than weekly. But right now, it is only released by the state, and it's only done weekly.
Okay. Well, the point of my question is obviously that spike that shoots up to 798 is disconcerting. But if out of that number, a certain percentage are being discharged, maybe a large percentage are being discharged and not hospitalized, I think that's important to know as well. Because out of that 798, 600 might be, I'm just making up numbers, but 600 might be discharged within 12 hours, but the rest might be hospitalized. So I think that's an important thing for our group to consider as well, because that spike looks alarming. But if most of those people are being sent home or being, or treated outside of the hospital, not being admitted to the hospital because we're concerned about facilities and capacity, I think that's important to know as well. So, thank you for continuing to find that information.
And I would clarify, I will ask, I'm almost certain that a large percentage, well north of 90% of those are not admitted. That's, this indicator is intended to just sort of look at what the community rate of flu is how this came from. So yes, these are generally not going to result in admission, but I'll try to quantify that better for you, ma'am.
That would be fantastic. And then the last slide, which is slide 12, which I had asked for some of that information. So thank you for putting that together. So I also want to point out that there's a part of the 0 to 12. Oh, it is 0 to 24. I'm sorry, I read that wrong. But 86% of hospitalizations, 86.52%. are people over the age of 65. That wasn't actually put on that screen, but I wanted to make sure that everybody had that number, that 86.52% of hospitalizations are for people 65 and over. And then the last question I had was on the testing, and I'm not sure if this is for you or Mr. Dudley, but on the testing, there's about a 2-week wait now to make an appointment with one of our locations in the county to get a test. Obviously, that you're talking about a big lag in time between someone who has symptoms and then finally is able to go get a test. They may actually test negative by the time they get the test. But what are we doing for in-home test? Are we doing anything for in-home test tracking? Because of the wait that people are experiencing to get an appointment, some people are now going to other vendors to get their tests done. In fact, I had someone contact me who ordered a test online from LabCorp on Sunday, received it in the mail on Tuesday, sent it back into the mail on Tuesday afternoon, and received her result today on Thursday. And it unfortunately was negative, which is great. But what are we doing to track those results? Because they're out there too. Are we doing anything to track that information?
Who's answering that?
I'm not sure who that's for. But I think a lot of people are going to start going to the in-home option if they have insurance and they're not wanting to wait 2 weeks to get a test. I think you're going to see a lot of people, an uptick in people doing the in-home testing if they have insurance or they're willing to pay $120 out of pocket. So what are we doing to track that information?
Mr. Dudley?
At this time, we are not tracking that option. So we'd have to take a look at that. I'll have conversations with Dr. Holt, but not at this time.
Okay, because I imagine if we see an uptick in that happening, that's going to impact the rates of positivity as well. So I think that we should not neglect that information in considering all of the statistics. So thank you very much for allowing me to ask a lot of questions. I really appreciate it.
Commissioner Merman, you're recognized.
Thank you, Mr. Chair. I guess I feel a need to respond to Mrs. Snively's questions, especially about the wait, because I continually call Liana Lopez or Mr. Dudley to ask them when I get a question from a constituent. And they have added a lot more testing appointments to the online portal. They have, now that we have the state taken over Raymond James, there's a lot more tests being done, and people, I have not heard about the 2 weeks wait. And I guess I would just ask Ms. Lopez if she's on the line. Is that true? Is there still a 2 week wait? Because as of last week, I think I talked to you on Thursday, that was not the case.
Hi, yes, Commissioner, I'm happy to address that. And I'll also turn to Tim Dudley related to the number of appointments that are available. So as of last week, it was not the case because the additional appointments with the state were added to the online appointment system. However, as of this morning, we are looking at the next appointment booking for July 17th. Now, I do know while this, in about 20 minutes, the teams are meeting operationally, emergency management, I think a member of the state, and I know that the teams will be meeting to see if additional appointments could be added to the system. As of about right at the time the EPG was starting, I believe, and probably Director Dudley could speak to this, the state added Monday to next week's scheduling, so there will be some availability for Monday for testing as they're closed this Saturday, and we were unable to schedule about 1,000 appointments for this week. And so as far as what we do in the call center, we make the appointments available and we ensure that the appointments are available to the public to book and that the call agents are booking those appointments. But as for the availability and expansion of appointments, we look to emergency management and operations for that. So I will ask Director Dudley to address that if you would like to.
Yes, we continue to look for ways to improve capacity. As you mentioned, Liana, we have an opportunity for Monday testing at Ray J, which they do 1,000 a day. So we'll have another 1,000 appointments that we'll add for Monday. Also, we're looking at expanding an additional test site. We're looking in the town and country area. We'll complete logistics reviews for operation to bring that site online. So that'll bring some more availability for capacity. So we're looking for every opportunity, but there is a huge demand. So the appointments are available and they're taking advantage of those appointments. The online program has been quite successful in easing the burden on the call system and making it easier for citizens able to schedule those appointments. The county sites are one of few resources here in the county to support testing.
And I just want to add one other thing on that. So, we did expand that capacity with the state, and I think Tim could speak to it, but I think we went from close to 4,000 appointments to almost 9,000. So there was I think there was some demand that was not being met that now is being booked, and hopefully those close to 9,000 appointments a week will serve our community better. But we more than doubled, nearly tripled our capacity on testing. So I just want everyone to realize that. And we do have other testing options for people that do have insurance or other options. Those are listed on our website on the testing page. So if someone does not want to book, they are provided with other information as to how to get a test.
Can I just add, if someone is sick and clearly waiting 2 weeks could be maybe a life or death situation. I mean, is there any way you can screen those people to possibly route them somewhere else or suggest they go? Because I know somebody the other day did tell me that they were having trouble getting online and she was already sick. And I told her to go to Tampa General Fast Track because those 10 sites have the 2-day rapid tests, though I don't think they're as reliable, but I don't know, Dr. Holt can opine on that. But I guess what I'm concerned about is that people that are sick and not just asymptomatic are not able to get the appointments when they need them. And I feel like maybe we should do something to help them instead of them going to the emergency room and clogging up our emergency rooms. So that's just, I appreciate what you all are doing. I know this is overwhelming, and there's a great need in the community for testing. So I think you're doing everything you can. I completely appreciate I did want to ask Mr. Dudley another question about testing. Does the private testing show up on the total tests that are done each week?
The in-home testing?
No, just private testing, like in physician offices or these urgent care centers, that type of thing.
That wouldn't be on my report. Dr. Holt, is that something that is captured in your report?
Well, yes, this is Dr. Holt. The reports that come back, the results that come back, will not identify if it was collected at a community center or the private center. Several months ago, when we had very limited testing and we had the hospitals and the community, he was able to collect some information from them that showed the amount of testing they were doing, and it was the majority of tests being done. But the public testing has ramped up significantly, but we do not know, and I can't tell you what number, how many they are doing. I just know that all of the results eventually, positive or negative, home test, mail test, anything else, has to be reported to the state of Florida, and those results do show up in our numbers.
Okay, thank you. I appreciate that. And also, I'm glad Ms. Snively clarified that the school system will be in charge of making their own decisions about whether teachers or students or administration will be wearing masks or not. I think that's important for the public to know that. And Dr. Holt, when will the dashboard chart be ready? Do you know?
No, I think we're really looking at a couple of options, and I'm not the best person to say. I think we're looking, we had, at least initially, we're still exploring, I believe, a dashboard that is more of a larger. It was one that you've seen Dr. Chang and the Tampa General people have established, and so I think we're still exploring how, but the breakthrough from my standpoint that I was very excited about is that the county now has at least shown us a way to automate the download of the information, and that's what drives the data. We'll continue to give you an update. I just don't know when.
Okay. Thank you all very much. I know everybody's working really hard, but I hope that you will think about these people that are really sick. They've kind of waited too long to go get tested and what their options are. If somebody calls the call center, and what they can recommend to them to do in order to get them the help they need right away, because I do worry about that because they're out infecting other people, and we probably need to get them some medical attention. Thank you.
Mayor Ross, you recognize.
Thank you, Mr. Chair. I'll be brief. I have a question for Dr. Holt. Dr. Holt, going back to the issue of asymptomatic positive people, there must be some source of that, because I looked at my notes at Monday's meeting, and I don't know if it was you or Mr. Wagner, and I'm not sure it was on a slide, but somewhere along the line on Monday it was put out that 11% of the positive test results over the previous 7 days had been asymptomatic, because I wrote it down. So somebody must have said that. But in any event, the takeaway from it is I agree with Mrs. Snively. I'd love to see if there's a way to kind of drill down into the asymptomatic or pre-symptomatic people, because, and I've been told, and I don't know if this was by you or another doctor, I'm not sure, but I've been told that asymptomatic or pre-symptomatic percentage goes way up in younger people. So the younger people that test positive are often 60 and 70% asymptomatic. And if that's true, the point I'm trying to make is that indicator of asymptomatic people or pre-symptomatic is key. to us as we try to develop mitigation strategies, because if 8 or 10% of the people that have this virus are asymptomatic, it might not call for the same actions if there's 80% of the people out there in the community that don't even know they have it. So I agree with Mrs. Snively. If there's a way to drill into that a little more and maybe include that, I don't know about every twice a week, but if we can kind of keep our finger on the pulse of that, that might help us to make some sound mitigation decisions. So thank you, Doctor.
Yes, sir. And I did say the 11. I was the source of 11%, and I need to probably clarify it once again. 11% is what the people who we talk to with the positives. We are not reaching them all, as I've been indicating, but 11% of those that were tested and that had positive, and we talked to, will say they were asymptomatic. The studies are clear that the actual number of people, not just the ones tested, because generally the people who are asymptomatic aren't rushing to get tested. The asymptomatic percentage for the illness is, I use a round number of 1/3, 33%. It's been anywhere from 25 to over 50% estimated by some studies. And as they've done antibody tests, that's even given them more questions of it, is it even higher? So there's two separate answers. The 11% is just a hard number that I can tell you when we interview people who were tested, came back positive, that's where that number comes from. The actual number of people who are infected and asymptomatic is again about 1/3 as a good middle point of all of the science. I'll stop there.
Thank you, Dr.
Mayor Castor, you recognize.
Thanks, Chair. When I raised my hand, I wanted to answer School Board Chair Snively's. Dr. Wilson sent us all a letter, and it said that 9 out of 10 of those individuals that presented themselves at the emergency room at Tampa General were released. And a couple of observations since I put my hand up. One is an assumption that I made, and that's where I make all of my mistakes, is on assumption. But I thought I heard Dr. Holt say in the past that the state received all of the lab reports. So I assume that would be, if I personally got a test and sent it to LabCorp, that the results of that based on my address would be reported to the state or whoever. But can you check on that, Dr. Holt, to ensure that we're getting the private lab results for our community? Because I agree with Ms. Snively that people are going to start using this private angle more and more. And with that said, I had someone log on to try to sign up for a test here because I was under, again, the assumption that the wait times had been reduced dramatically, and the soonest we could sign up for a test would be the 16th or 17th of July. So people are going to go the private route. I agree. We need to make sure that if they're from our community, we can at least get that information of positive cases. Clearly not an identification of an individual, but at least the number of positive cases. That's all.
Yes, ma'am. This is Dr. Holt. I can be 100% certain if it's a LabCorp, Quest, any commercial legitimate lab that operates with a license in the state of Florida, or even wants to run a lab from the state of Florida. So in other words, when they're mailed out or shipped out, it is a state law and a requirement that those results be reported to the state. So I have no doubt about the LabCorp and the Quest. There are other types of antibody tests, other things where there's people, solicited tests that I will not promise or would not I wouldn't vouch for. But as far as the ones that you're talking or heard about, which is the mail orders, that's really what the way the state's now working to do the long-term care staff is the oral swabs that are mailed back to a lab. So we indeed get any positive or all labs, positive or negative, that is run private or public in the state or on someone who's in the state. I'll stop there.
Commissioner Overman, you have another question?
Just one. And Dr. Chang and Dr. Wilson have given us some updated information and can provide us with more current data on our emergency room admissions. They've come to us before and given it to us. And while I hate to ask them to come on Monday, right after a 3-day weekend or a holiday weekend, because they're liable to be slammed, I think it is important, because we do have a big holiday, that we get current emergency room information. And the collaborative team that works at the hospitals do go over these numbers and can give us current numbers. So I think we can get the information that Ms. Snively is looking for, and I thank you for your questions and answers. But I'd like to see if it's possible that we could have a report from them on Monday, if they're willing. I know Dr. Chang is on the line. I don't know if he'd like to comment at all.
Snide, do you have another question?
Yes, thank you. Thank you so much, Mr. Chair. I had just one more question kind of related to one of the public comments was, I think, talking about recovery rates. And I think that's another important data point that I don't know if that's trackable, but recovery rates are something that I think should be included in the data presentations. And maybe for Monday, Dr. Holt, could you talk a little bit about dexamethasone and the implication that has had on the recovery rate? So I don't know if that's something we want to see on a weekly basis, but I would like to hear about the recovery rates, maybe on Monday, what the recovery rates are looking like and the impact that dexamethasone has had on the recovery rates, and then maybe it's its impact on freeing up the ventilators for our hospitals and facilities. Thank you.
I can certainly speak on the recovery rate, at least the estimates. It is not a direct callback to see if somebody after 30 days, are they still with us? So we use estimates that if they didn't die in that period of time, and I certainly will be a more precise number than I mentioned, I think the last time this was called or asked. As far as the medical management, I will reach out to one of my colleagues, because I'm not a practicing physician like I used to be. And so while I can read the studies, I would prefer to have one of them kind of tell you what's really happening with that, if that's acceptable.
Thank you very much. I really appreciate that.
I want to call on Ms. Leona Lopez to give her report, but before I do that, I want to thank Ms. Lopez and her staff, and Mr. Dudley and his staff, and all those involved in doing everything you possibly can to get the citizens of this county a test. You have done everything we've asked you to do, and sometimes going above and beyond what we've asked you to do. As I tell people, and I'm going to tell this group, there is no book that was written, and you can't Google this pandemic and it tells you what to do. And those that are around in 1918 didn't leave us any instructions either. So the staff is doing the very best they can do. We're appreciative that the state came in and started taking over Raymond James, doing 1,000 tests per day. But the demand, as I talked to Mr. Dudley, Ms. Lopez, the demand is astronomical. I mean, astronomical. And they're doing everything, and they're doing everything we've asked them to do, and possibly even more than we've asked them to do. So I just wanted to say that. Ms. Lopez, you recognize.
Thank you, Commissioner, for that, and thank you, members of the EPG, for allowing me to provide a brief update on the dashboard we've been discussing. We plan to launch on our website for our residents to have direct access to the data driving many of the decisions being made in our community's response to COVID-19. Last Thursday, this body directed county communications to work with the various partners to launch a dashboard or snapshot of this critical data for our community. By the conclusion of the meeting, I had county departments contact me to advise they were already working on such an effort. My teammates were also aware of some of the efforts. Basically, we had several teams working on different COVID-19 dashboards. As such, I asked our digital engagement manager, Brian Roberts, to convene the teams and work to develop a quick and responsive path forward. To recap this week, he pulled together the various teams to bring the best people from each group to work toward a common goal, a COVID-19 community dashboard using data standards and a proven platform. As Dr. Holt addressed, the team consists of IIO, emergency management, and healthcare services working with our external partners. The team is working to develop a dashboard that simply serves as a platform that aggregates the data from the originating organizations. This is critical to the process to ensure accountability and trust with the public we serve. It's very important to all of us at the county and to our partners involved that the residents understand we're not owners of the data, we're simply aggregating the data from the owners into a dashboard that displays the data in a simple, easy to digest format. I know Dr. Holt addressed this, but the team does expect to be able to launch a preliminary dashboard next week, and we will remain committed to working with our partners, including the hospital systems, to ensure we provide as much data as we are able to in a transparent manner. With that said, this dashboard will not be static, as we will address data sets that we will add data sets that will enhance our communication with the public as we continue our community response to COVID-19. In fact, based on the very preliminary discussions, one addition we hope to be able to adapt quickly are specific data sets in the Florida West Coast region data exchange that Dr. Chang at TGH aggregates already from our partners in various hospital systems. So we're hoping to work with Dr. Chang and aggregate get some of that aggregated data to add it to our dashboard. I do want to mention, as it came up earlier and was requested last week, other testing options are on the county's website, as I previously mentioned, and call times are at about 4 minutes, but we could use some more appointment availability, and we are working on that. So this concludes my presentation for the moment, but I do remain available for questions.
Thank you, Ms. Lopez. And at this time, I see no questions.
Okay,
thank you for your presentation. Thank you.
Thank you very much.
County Attorney update, Ms. Beck.
Yes, good afternoon, EPG board members, Chair Miller, Christine Beck, County Attorney. Got a very brief update today. We wanted to make sure you were aware of Governor DeSantis's Executive Order 20-159, which has relates to mortgage foreclosures and eviction relief. And previously, an order had suspended and told any statutes providing for those actions, and this order has now extended that suspension until August 1st of 2020. And secondly, we have the extension of the local state of emergency order that has been distributed again as part of your backup. And at this time, Mr. Chair, it would be appropriate to entertain a motion for that order.
Is there a motion?
I'll move approval. Commissioner Merman.
Motion by Commissioner Merman. Is there a second?
Second.
Second by Commissioner Overman. Is there any discussion on the motion? Any discussion on the motion? Any discussion on the motion? Seeing none, please call the roll.
Miller?
Yes.
Overman?
Yes.
Merman?
Yes.
Cronister?
Yes.
Castor?
Yes.
Ross?
Yes.
Lott?
Yes.
Snively?
Yes.
Motion carried 8-0.
Okay, Ms. Beck, is there anything further you need to bring for us today?
No, sir.
Okay, thank you very much. We now open the floor up for any EPG discussions. Is there anything that anyone wants to discuss at this particular point in time? Commissioner Overman, you recognize.
Thank you. I appreciate that. Couple of things. I'd love to get a report back on the meeting between Governor DeSantis and Vice President Pence on Monday, if at all possible. I'm not sure who, maybe Ms. Beck can give us an update on their discussion. But I'd also like to ask if this is for Ms. Wise. I know she's doing a great job and she's been getting questions from a constituent. She wrote, please put a statistician on your EPG meeting so the key data can be highlighted in a palatable manner. I'm sure Ms. Leanna Lopez will help with that. But I'm curious if we could get the actual slides that we see each meeting on the website in some place, because it is difficult for the public to see all the data that we're seeing. I share it on my fan page if I can create it into a video and do so, but it's really helpful for people to see all the data we're looking at. And while we're putting together a nice dashboard that's current, it would be, I think, an advantage of having these slides available for public consumption, because they get a real quick glance at it, and sometimes it's very hard to read. So I wanted to know if that's at all possible to do that. And as I mentioned, I'd love to get a report back from the DeSantis-Pence meeting to hear how that went, since it's here in Hillsborough County. It'd be nice to get a report on that. And that's other than having a report from our emergency room health advisory team on Monday, that was really all I had for today.
Commissioner Overman, instead of asking for Ms. Beck to bring that information back from Pence and the governor, I'm going to ask that Mr. Brandon Wagner.
Fine.
Do that. He's over our government department. I think he's the one should bring that back. Okay.
Excellent. Thank you.
Ms. Snively, you recognized.
Thank you, Mr. Chair. One other thing I wanted to share with the group, because I know that in addition to school board members probably getting a lot of contacts from their constituents about this, you too, as public officials, may also be getting some feedback from parents about this. And as many of you know recently, and thank you for allowing me to take a few minutes to do this on a public forum. As you know, recently, due to COVID and the spike, the superintendent made the executive decision to not have traditional graduations. And now we will be offering virtual graduations to our seniors. And so I wanted to assure everyone that every stone was not left unturned in considering different venues. Some venues that seemed obvious were not available, like Raymond James was available, but the logistics of cleaning after every single ceremony and the logistics of getting people in and out of Raymond James Stadium was going to be cost prohibitive to the school district. So same thing with logistics around school stadiums and so forth. So I want to assure everyone that the superintendent and his graduation team and leadership team considered a lot of different options because he really wanted to make it a traditional ceremony for the students. And I know that since May, we've been hoping to go with Plan A, which would be the traditional graduation ceremony. However, he did promise the public that by July 1st, that he would make a final decision on what the graduations would look like. And he did make that decision actually June the 30th to have a virtual ceremony. And so I just wanted to read a brief statement he would like me to share with you and the public with regard to graduations, because I know it affects over 12,000, at least 12,000 families across the county. It says, this is from Mr. Addison Davis, our superintendent. My heart goes out to the class of 2020. I recognize that each of our graduates worked tremendously hard during their senior year, and this is not the outcome we wanted for them. It has always been our goal to give our seniors a traditional graduation ceremony where friends and family can share in their big moment. We hoped by July that cases would be trending downward, but that's not the case. Although we have made this difficult decision to move the ceremonies online, nothing changes in the fact that students will have their opportunity to commemorate this occasion with their families. While traditional graduations are unable to take place, every school will be planning to host a diploma celebration that recognizes our students' accomplishments. Every student will have the opportunity to wear their cap and gown, take a photo with their principal on a stage, and turn their tassel. This will be a fun event that celebrates our graduates. And so thank you for allowing me a moment to read that from the superintendent and hopefully give you information so that you can share factual information with your constituents that probably are going to be reaching out to you asking why the superintendent has made that decision. So, but thank you so much for your time. Thank you.
Thank you, Ms. Snively, and thank you, Mr. Superintendent. Appreciate that. Anything else? Any other discussions from any members? Any other discussion from any members? Seeing no hands. Everyone have a fantastic, enjoyable, fun-filled 4th of July. But please, please, please stay safe. Seeing no further hands, we are adjourned.
Happy 4th.
Happy Independence Day.